Okay, we're at 2 minutes past one now, so I will kick off. I was eagerly anticipating the people numbers ratcheting up to hit 100, but maybe we'll get there as we kick off. And of course, people can watch the session back as well. So we'll be going wider than that. Welcome everyone to this second Health Anchors Learning Network show and tell. I'm Chris Morton. I work as Deputy Director of Finance at Digital Health and Care Wales, and I've led the work here in terms of our social value strategy. Thank you so much for taking the time to join us today for what I think promises to be another great session in terms of sharing the knowledge from other health anchors across the UK. This is the second webinar looking at the role of the NHS organisations as anchor institutions. I think if you remember in the first session, we covered what it meant to be an anchor organisation, and we looked at some of the different levers that anchor organisations have at their disposal to positively impact local communities. So in this session today, we're going to consider what it means to turn this vision of being an anchor institution into a reality, and also cover some of the benefits of having a whole organisation-wide strategy approach to being an anchor institution. We're very fortunate to have with us two guest speakers today. So today we're going to hear from Vicky Oxley, who is the Deputy Director of Strategy and Partnerships at Cwm Taf Morgannwg University Health Board, and we also welcome Wayne Daly, who is the Head of Corporate and Social Responsibility at Northumbria Healthcare NHS Foundation Trust. We will, after the presentations, have some time for questions and answers, so please do think of some questions as you're going through that, and a reminder, you can also use the chat function as well. As Lauren said at the start, the session is being recorded today, and you'll be able to watch the link back as well and share it with your colleagues if they were not able to join the session today. Okay, so without further ado, that was just a quick introduction. I would like to now hand over to Vicky, who will take us through the approach from Cwm Taf Morgannwg. So thank you, Vicky.
Thank you very much. I'm just going to start sharing. Can someone give me a nod or a yes if people can see that? So
I can see that, so it looks perfect. Good to go, Vicky. Thank you.
Thank you very much. So thanks for the invite to talk today. So this cover sheet really is our strategic vision from Cwm Taf Morgannwg University Health Board, and I wanted to just include it today because for me this fits in and sets out well why we are an anchor. Why we're taking up an anchor approach, because that is really important around building healthier communities together. So I just wanted to include that. So let me just move on. So today, hopefully, what you'll hear about is a bit about our anchor strategy and also about some of the key things that we have learned and some of the challenges as well. But one of the key things, and I was really clear when I sort of accepted the invite to talk today, is I'm not an expert on this. This is very much an organisational wide piece of work that we're doing. So very happy to take questions at the end and things, but I might not be able to answer them all, and I might need to go away and get the answers for you. And I am sure that a lot of what you'll hear today are things that you're doing as well in your own organisations. So basically, it's about setting out the work that we're doing, but just to make it really clear, I'm not an expert on this. So the image on the right is our strategy. We do actually have one. We established it in 2022 and it finishes this year, and we are looking at how we refresh and rework that strategy. And the image on the left is really why we need one. This won't come to news to any of you, but you know, 20%, it's only 20% of their people's health and wellbeing outcomes that are impacted by health services, and the other 80% is derived by everything else in their lives. And so this is really important in my mind as to why we need to play a role as an anchor institution, because the services that we offer only just touch on people's health and wellbeing. So our strategy, I'm not expecting to read all this, but our strategy just has a lot of outcomes and goals set out within it. And I'm going to be really honest, we're in 2025 and we haven't achieved them all. we've done some and we've made progress against some, and we've done things that in my mind fit as part of our anchor strategy but wasn't set out in 2022 because the world moves on. But really clear we didn't achieve everything, so this isn't a sort of aren't we great, we've done everything kind of presentation, but it is about that. It is really hard to do some of this because it's about working in partnership, and it's some really big wide system stuff as well as part of it. So these are the things that we see as 6 ways of how we can make an impact. And it's about how we use the resources that we've got available to ourselves and how we can influence and work with others to act as an anchor organisation within our communities. So again, I imagine that these are all things that everybody's working on. So workforce, employment, procurement, and how we spend our money, how we use our estate and infrastructure, our environmental impact, how we work with other organisations as well, and how we engage with our communities. So the next few slides, I'm just going to run through some of the things that we have achieved as part of the strategy. And just to be clear, I can't be credited with a lot of this work. This is very much a organisational wide achievement. So this one starts with workforce and employment. I'm not going to read them all out, but as you can see, we're looking at various approaches to workforce and employment as part of the work that we're doing. Nearly 80% of our staff live within our patch, so this is something that we can have a real impact on in regards to being an anchor organisation in our community. So the first one is Project Search, which is around working with people with learning disabilities and employing them. And we've done that through another organisation, working in partnership with another organisation. Oh, sorry. I keep going. Another organisation within our patch, which is Elite, and they do a lot of work around supporting people with learning disabilities into employment. It covers things such as use of Welsh language and the importance of that about engaging our communities, both our workforce and the people that use our services, and how we advertise and employ people as well. So it's not on here, but one of the things we have done is we ran a different way of looking at employing Band 3 support workers up at Prince Charles, where we did on the day, we advertised on social media. We brought people in on the day, had conversations, filled out an application, were interviewed and offered a job on that day. And that really starting to change how we can employ people differently from our communities moving forward. This next slide is quite a busy one, but it sets out how we spend some of our money. And what you might not be able to see very well, but in the table on the right hand side, year to date at the moment, we've spent 49% on suppliers who have Welsh headquarters. I said I'd cover some of the challenges as well. And one of the challenges we have is that we can't currently understand, we're not able to see how we spend on Welsh products because we haven't got that level of information at the moment. But what we can understand is how we spend on services or products from those organisations that have a headquarters in Wales. So I know that that's work that is ongoing through shared services about how we can start to understand the granularity of detail of some of this. But from our perspective, we see this as the slides are positive. Over the years, we have increased the spend that we've done with companies with headquarters in Wales. So this is one of the ones that I always think is more of a difficult one to show the benefit from an anchor organisation perspective. But we've got 2 examples here. So the first one is around solar farm development, which gives which will allow us to have better make different decisions. I shouldn't say better, but different decisions around how we spend some of our finances. Because we will be getting some of our energy. So the first one around the RCT Council one, on sunny days, and I know it's really hard to think that sometimes in the middle of winter, but on sunny days it will, that solar farm in RCT will fully power Royal Glamorgan Hospital. So obviously, we're still paying for that, but it's about how we spending our money differently. And then the second one is up in Merthyr Tydfil, and that's in a partnership again with another anchor organisation or a school, and we will be taking their excess energy. So again, that energy is being utilised locally, which I think is a brilliant thing. And maximising the viability of the scheme, as well as obviously the environmental impacts for our communities as well. And then the second bullet point is about how we utilise our estate in partnership with third sector organisations. So the organisations listed in there use some of our sites, but this is something that we know we can do better on. So this is challenging. This is challenging from an estate perspective and a space perspective, but also around how we think about how we charge for some of this space as well. So this is something that we know we need to do better on moving forward. So from an environmental perspective, so tackling decarbonisation, climate change and adaptation seriously is a key element of how we see ourselves as being an anchor organisation. Last week's rains in our areas absolutely highlighted the impact of the changing climate in our communities. And I chose these examples as they showed the breadth of the work that we do here. So for example, as well as doing things like changing all our lighting to LED, we are looking at how we can do different things as well. So we're looking at how we use our estate differently and how we can encourage better use of our grounds. So we've been developing courtyards, because I don't know if people are familiar with CTM sites, but we have a lot of outdoor courtyard space that hasn't been traditionally well utilised. So we've been looking at how we can use, well, we have been using our funding from the charity to redevelop that. But there are challenges around that ongoing maintenance. Is this done through volunteer services? Is it done through our paid staff? So sometimes opportunities also bring with them some quite interesting challenges that we may not have anticipated. The second example is around how we utilised some of our plastics into making chairs. But again, one of the thing with this is around us being, we did this in partnership with Elite, which is an organisation based in Merthyr. They also employ people with learning disabilities. So it's that wider reach of being, so what a project can do, but also the wider reach and the positive impacts it can have within our communities as well. And then the third one, again, is as well as obviously reducing food waste and utilising food waste. It's another example of how we've used a Welsh company as well. So again, trying to keep that spend and the activity within Wales as part of our anchor responsibilities. One of the things we had set out around in our strategy was being part of a network, and we're here today, so we are now, which is fantastic. And our community leaders, which is, and that is a live link. So if these slides are shared afterwards, you can follow the link to that site. That's a really important network for us. We've got over 130 members now from community groups within our patch. And it's a fantastic way of us being able to work with people who much better understand our communities than we do. And it's an invaluable network for us and something that we utilise a lot. We're also trying to change how we work with our communities, so moving from much more from a transactional relationship approach, which probably has been quite traditional in health, that you know, people rock up, we do something to them, and then they go, well, what we're trying to do is better understand our communities and what people actually need from us as a health organisation, and not just around those services. And it's coming back to the start of the presentation around the fact that 80% isn't to do with our services, it's about how we interact with our people and the lives that they lead. So we've been really trying to understand through things like appreciative inquiry, storytelling, and capturing through ripple effect mapping. And I've got my final slide covers that off, because we recognise that people are our best asset. And the last example is that we've employed, through thinking about this differently, we've employed a health, housing and innovation manager. And from what I understand, it was the first, and I think still maybe the only person in that role in Wales that has been appointed on a partnership basis with the RSL. So we pay for the time partly as a health board, but the registered social landlords also pay towards that role as well, because they recognise that we all recognise the importance and the interrelationships between health and housing, and how some of the work that we can do together can really have that impact on people's wider lives. So I gave an example here around data linkage and how we can use our data differently to enable targeted interventions, such as insulation in housing with people with respiratory conditions. But the role and the work that we've been doing was influential last year around increasing the number of people taking up pension credit as well, within our footprint. So again, it's just that breadth and that reach. You won't be able to read this, and I'm sorry, but you might be able, if we share the slides, you'll be able to see it. But I just wanted to include this because one of the things that we found really challenging as being part of as being seen as an anchor organisation is that how you show the impact of that. And so this is why we're trying to explore different ways of capturing that. And this is a ripple effect mapping. And it's the start. So the start of the journey is towards the left-hand side. The pinky blob was some appreciative inquiry training that we did. So it was the healthy housing manager that I mentioned previously, along in partnership with our public health team, undertook appreciative inquiry training with registered social landlords. And this just shows the impact of some of that, and actually how we listen to our communities will change that. So on the back of that training and from people listening and acting differently, we've now seen a massive increase in the use of a community centre, which has set up things like bingo and a men's club and things. So we're starting to reduce isolation. It's also set up a homework club for the local school. So it's about having that impact in the education sphere. It started litter picking. So it's all of those things that can fall out of different ways of working as an anchor organisation. But this was just I think this is a really lovely way of starting to show that impact as well, because I know one of the main challenges is about how we do that. So I am going to stop talking now and stop sharing and hand back to you, Chris. So thank you very much.
Thanks, Vicky. Really, really helpful. And I think quite a diverse range of examples that you've provided there from the work that Cwmtaf Morgannwg has been doing in this space. I will open it up to any questions that people might have. So again, please feel free to raise your hands, or you can use the chat function as well. Hugh.
Thanks. That was really, really powerful, especially the section where you talked about the community engagement and the network you've got in the engagement. I've been thinking a lot recently about the challenges we've got in public sector with trust, trust between citizens and the state, trust between various parts of the public sector. And I think there's something quite powerful about using networks of people in our communities to help us frame how we plan services, how we plan to allocate resources, and how we're utilising them. I'd like to have a conversation perhaps offline about how you've gone about generating that community and what could we do similarly to reflect on that in our health board. Thank you. Really, really good.
Absolutely, Hugh. No problem.
Thanks, Hugh. Richard, do you have a question?
Yeah, I do. It's just I'm wondering more about how you engaged with the voluntary sector and how you got them on board and brought them into the conversation, because I think there's a lot of scope there.
Yeah, so this, I have to say that the work of the setting up the community network has to go to a lady called Natasha Weeks, who's one of our engagement officers, and she has been the person that's really driven it. And it started off we touched on, we had one last month. We have them quarterly, we have them face to face, and we move them around the patch. And we had a bit of discussion last time about whether it started in May or July 2022. So they've been going a while, and we started off with quite a small group. I think there was around 30 organisations, and we've grown to over 130 now. Yeah. And it has mainly been on word of mouth from organised. So basically starting having those conversations with people. And it's what we're really trying to make, what we try to ensure it isn't, is us turning up and just going, this is what we're doing, because that's not very engaging for them or useful. So what we try to do is we hear from them what it is that their communities are talking about. We ask their opinion on things. We gather it. So it's very much, I'd like to see it as a proper relationship between the wider group and the health board. We have had, I'll be really honest, we have had to check ourselves at times that we've not just been on sort of transmit out, because sometimes it's quite tempting to do that, isn't it? But the last one, for example, was focused on mental health, because mental health is pervasive through all of our communities. So we had a really big conversation about mental health and how our services do or don't always meet the needs, and what we can do to start thinking about that. So it's really been a bit of a snowball effect, and I think we see it as the fact that people keep turning up it's working for them and for us. It's not always the same people every time, often depends on where we have it. So if it's up in Merthyr, we might not always get as big a turnout from the Bridge End for organisations, for example, but people do keep coming. And like I said, Natasha was instrumental in setting it up. So, but if there's anything specific, happy to try and answer outside the meeting.
Yeah, and if that's okay, if I can contact you for, because I'm also interested in how you engage with private sector organisations in the patch as well that might want to support such developments. But yeah, if it's okay, I'll drop you a line.
Of course,
Thanks.
Yeah. Thanks, Vicky. Thanks, Richard. That's great. We also have a question in the chat. So Ollie's put in the chat, to what extent do you feel having all these ambitions packaged together as part of a specific anchor strategy has made a difference?
I think it's helped to show the impact that I think it's that. So rather than necessarily, it feels less piecemeal. It's not perfect, Ollie. Like I said, we haven't delivered on everything that we set out to do in the strategy through various reasons, resourcing, changing people, changing focus. But I think what it's shown is it shows us that reach that we have that we don't necessarily always see. And that's why I like things like ripple effect mapping, because you can see something that you may not have anticipated. And I think we're very good as health boards at counting widgets of things, but we might not be always as good as at the softer well, it's called softer, isn't it? But it isn't really. But the understanding the softer impact of it, and I think that this work for us and how we're trying to capture some of the impact is being the real benefit and strength, I think.
I suppose just a quick follow on from that, because again, you'd mentioned, Vicky, around the strategy, you'd achieve some objectives, but not all of them. Again, bearing in mind, this was kind of 3 years in, started with the strategy 2022. Do you have any kind of lessons learned or reflections in terms of what you might do differently in that next round of strategy planning?
Yeah, so this was our first one, and I think now we're a few years down the line, I think we'll better engage with our teams across the board. I'll be really honest, it feels, because I came into role just as this was being launched, and so my experience of it as a strategy is it's felt quite siloed, where I think moving forward what we'll probably do better at is bringing it, like I said, is the bringing it together bit. So some of the stuff that we do in around the infrastructure and estate impacts on the environmental areas as well, and it's much more of a web, I think. And so I think it's about how we look at what it is that we're wanting to achieve rather than what it is that we think we can do, if that makes sense. So this strategy felt very much like, this is what we think we can do, which there's nothing wrong with that because it was our first one. But I think moving forward, I think it's more, what do we want to achieve and how do we then do that? So flip it, really.
Yeah, and I think that's a fair reflection, and probably a similar one again coming into DHCW and looking at the way we do things. It's felt at the moment that we've kind of got these focused pockets across, our people work that we do, the estates work that's focused on decarbonisation, so you've got these kind of silos, but again, there's work for us to do in terms of how we join the dots and again make the most out of those cross-cutting opportunities as well. Does anyone else have any further questions? I've just got one final one for you, Vicky, sorry, before we do move on. And it is linked to the work with communities, actually, because again, you talked about that cultural shift in working. Was there, and you've also mentioned the ripple effects mapping as well. Are there any kind of learnings from that aspect? Have you got any particular methods or tools that you might recommend in doing that community engagement piece from the work that you've done in that area?
So appreciative inquiry conversations and training has worked really well, a bit too well in some respects, because the teams that have been doing it have been kind of been overwhelmed with people wanting them to train them in it, and I think that has been it's been incredibly insightful as to what our communities tell us, and a lot of it isn't what we've necessarily thought it would be. The thing to learn with that is it's really quite resource intensive, and you have to go with it, and let go of that control that as a big statutory organisation we're probably not always been that good at, and we have to listen and then be able to respond as well. So it is resource intensive. One of the it's really hyper local. We started this in 3 communities. I didn't put it on the slides, but we started it in 3 communities. And what I mean by three basically like neighbourhoods, and started there mainly because we were working to start off with the registered social landlords. So that felt it felt like a good place to start. It's now rolling out beyond that, but it's I don't know how to describe this, but it is being reasonably you've got to be open to what comes back, and you might not always like it, but you've asked, so you've got to listen, and you've got to then think about how you respond to that. So I think the thing for me is, if you're going to change it, you've got to be committed to it, and you've got to realise that it is resource intensive. That hyperlocal engagement, which is what we're trying to do here, is resource intensive. It's not just putting on a meeting at a town hall and asking somebody what they think. It's much more than that. And it's nothing to say that there isn't a place for the town hall engagement, but it is really resource intensive, and you've got to go with it.
That's great. No, thank you. And I think, again, it'd be interesting for us to start pulling together some of these particular approaches and resources, if there are particular methods and tools that people can use. So again, we can start sharing those across our network. Thank you very much, Vicky. Really appreciate that. So I'd like to turn now to an example from outside of Wales. So we've got Wayne Daly here with us, Head of Corporate and Social Responsibility at Northumbria Healthcare NHS Foundation Trust. So over to you, Wayne.
Thank you. Ollie, I'm going to have a go at sharing my slides. If you can tell me you've got them, I'll be very happy. Can you see them on your screen there?
I can see them, Wayne. Yep, so it looks good. Thank you very much.
Fantastic. Right. Thank you very much. And first of all, thank you very much for the invite today. Just a very quick introduction, because you're probably looking at that and thinking, an NHS trust with a head of corporate and social responsibility. I do more than that within my team. Interestingly, on the questions we've had before about engagement, sit with an engagement team. We also have governors and foundation, which sit within my team. We also look after our staff lottery, and just recently we have taken on board our international area within the trust as well, and commercial bid coordination, which will make sense as I go through some of this, particularly around our procurement. But what I want to do over the next sort of 10-15 minutes is just to give you a little bit of a background into Northumbria, developing and how we developed our community promise, which is our social value ethos. Some examples which I've taken from our activity, looking at that wider system, that whole anchor approach, which obviously is very much what we're focused on today, but also looking forward as well. What I thought, and I'm sure you've all got the stats on NHS performance, but if you look at Northumbria particularly, we're a high performing acute trust in an area of the northeast of England. Against virtually all measures, we're performing incredibly well. But interestingly, if you overlay that really good performance as an NHS trust, you look at some long-term generational impacts of health inequalities in our area. Whilst those figures are a couple of years out of date, trust me, there is very little change in them. So in terms of things like life expectancy and healthy life expectancy, the northeast, and particularly the area we cover, which is that area at the very, very top right hand side, the darkest, has some of the worst health outcomes. And again, that just reaffirms it. If we compare it with London, even some of the most deprived areas in London, we still perform very badly in comparison to some of our neighbours, despite having outstanding healthcare. In terms of our geographic area, and again, the reason I'm mentioning that is this is how we developed our community promise. This is the area that we cover as a trust. So we're about the size of Luxembourg. We cover right up to the Scottish borders and right down into North Tyneside. If you look at Northumberland on the map there, around 70% of the population live in that small little corridor between 3, 4 and 7 on the map. And North Tyneside has around 211,000. Northumberland in itself has around 311,000. So actually, we're serving a population of around about 500,000, but in quite, in some areas quite urban, but the majority are quite a rural community. So the start of the community promise was Jim, who I'm sure you all recognise there. Jim brought me in on an initial 6-month contract back in 2020. Just said, look, can you have a look at what we're doing? I think we need to do something more because there's this long-term generational. Jim's really passionate about some of these added value things that as an organisation, as an NHS trust, as an anchor institution, we can and should be doing. He said, just come in, just give me your warts and all. So did a report. We then, from that report, developed the community promise, and obviously I ended up getting a substantive role within the trust. But it was very much focused on about what we could do, what was within our gift, what's within our power that we could do. But there was a wider system working part of that as well. So we were the first NHS trust in the country to make a formal commitment around our social value. It is looking at the economic development, social issues, health inequalities, and again, those better health outcomes, which I referenced at the beginning of the discussion, but also around some of those things that are in our control, around our job creation, our talent pools, and about how we spend our money. This is what we have as our community promise. I know we'll be sharing these slides, but essentially it is going beyond that of being a traditional healthcare provider in looking at our role as a buyer, as a purchaser, as an employer, as an anchor institution in our communities. And we have our 5 key pillars there. Now, you can read these at your leisure when we share these slides, but that top line is the one that I really focus on: finding our future talent, retaining and creating jobs, that are buying local, spending local, promoting net zero, that sustainability, which we discussed earlier on in the call, and about supporting our patients and our staff and our communities. And those are the pillars which actually reinforce what we do as an organization. Now, here's a couple of little quick snippets from what we did last year, and I'm going to draw out a little bit more detail and come on to the anchor approach as we go forward. But in terms of our procurement, we generated around £840,000 for good social causes as a result of some of the procurement we've done. That is just a small portion of some of the bigger work which we've done. We've run careers events, our mini scrubs, which we produced mini uniforms in our Seaton Delaval factory. 17,000 of them were distributed free of charge around our schools to actually enthuse and inform primary students, that's in primary schools, about the depth and the breadth of employment opportunities within the NHS. We have over 300 suppliers who work with us. Our recruitment and retention rate around our apprentices is really high, and we're also very much focused around supporting our apprentices around involvement with the 5% club. So if I'm coming to a little bit of detail now, because this I think informs where we are with our community promise. So although this sits within my team, I hold a ring on it. Every one of our 5 pillars has a lead in the organization, and it is business as usual now. So the board gave us the permission to go forward. I did a board paper. The board said, right, this is what we're going to do. This is the commitment we're making. We have named pillar leads who lead on all of these areas within their day job, but very much focused around understanding what that commitment is in each of those pillars. So about a year and a half ago, I went back to board and said, as part of our education offer, we need to get into our schools. We need to get that future talent. So I got commitment from the board for 5 widening participation team members. They go out and about, they work with schools. We offer work experience throughout the year. Last year we did 175. Just in Q2, so the last quarter, we've done 69. So we're already absolutely going to smash that for 2025. We're doing a big piece of work around our special education needs schools and individuals. So we also offer work experience to SEND students and SEND schools, and we also go out and engage with them. We're doing a massive piece of work around promoting health and social care roles, and particularly an understanding for teaching staff to know what the variety of jobs are within the NHS. Around 350 different job opportunities. I used to work in a school, so I know this. I have lots of friends who are school teachers, and often you will have gone from school to university to work in the pub and then back to school, and you might not have been immersed in what the wider employment opportunities are in an area. So we do CPD days for teaching staff so they understand the depth and the breadth and the opportunities. And again, those mini scrubs which you see with those young people wearing them, made locally, they went out to every single primary school with a teaching pack which showed and demonstrated how young people can think about a career beyond a nurse, beyond a doctor, where we're looking at engineers, we're looking at finance, we're looking at chefs. There's some really, really good work around that CPD offer which we developed, and again, that work experience placement. And just last week, we launched our Careers Ambassador Network, which is our staff with lived experience of working in the NHS, some of them long-term, some of them like me just in the last 5 years. We've committed and we've signed up to going out to be the sales ambassadors of this organisation, to talk to young people in schools and colleges about what they can do and what a future in the NHS can actually look like. So we've called that the Career Ambassador Network, and we've got 60 people who've actually now signed up to do that. In terms of our employment, as you've seen on the previous slide, 456 of our director entry apprentices have actually come from, sorry, that was the number we've recruited between that figure, but 66% of them have actually come from our most deprived 3 IMD communities. That's the most deprived in our trust area. We're now getting 66% of that 456 figure from those communities. When we started the community promise, it was at 22%. So you can see there's been a massive piece of work. We use data to drive where we go. I'm not really interested in the hotspots. I'm not interested in those nice schools that always gave us apprentices. I'm interested in the ones that don't. And because they don't, we get in there, we work with them, and we engage with them. The skills boot camps as well. We're also supporting our own staff. So 259 of our staff have actually gone through what you would call those core skills, those functional skills, to support them. So it's about that lifelong learning. And interestingly as well, part of that work engagement, the deep dive using data, means that we're above the average in terms of the number of people we employ within the trust with a disability. Just touching very briefly on the economy area as well. over 25% of our procurement is done with companies within our trust area itself. Our local spend is 6.75 million. We want that to be better. I always say this to people because it's important. As an anchor institution, we put money into the pockets of our staff. 34 million pounds goes into their pockets every month, which they spend in cafes, in high streets, in supermarkets, buying things, paying mortgages. So absolutely that economic driver and understanding the importance of that. And as part of our new procurement process, we're developing what the ask is. So that is about what we want from those organizations working with us in terms of apprenticeships, employment, targeting some of those hard to reach areas, and particularly working with the future talents, our schools and our colleges. And again, if anyone wants to check this on the slides when they're shared, the Social Value Public Services Act is very clear about the role of the NHS and public sector organisations in what they can do to be an economic driver and an influencer of social change in their communities. We're also part of a wider system as well, which is the Great North Healthcare Alliance, which is a joining of Newcastle, Gateshead, Northumbria and North Cumbria into a large area, which is about, yes, developing a patient pathway. We have a joint chair who coordinates things around those four organisations. But for me, there's some really important things which have been put in there. It's that acceptance of the work that we and responsibility that we have around reducing health inequalities. But also that nice big chunky figure at the bottom there, 3.4 billion annual spend. And if we can channel some of that into social good and improving our procurement processes, we will be able to make some of those changes and those influences that we need to do in our communities. And that's a big piece of work which is ongoing now. In terms of that wider anchor work, so we've got our 5 pillars, we're doing lots of things within the organisation. But the wider system, that anchor approach, is something that we've been really good at developing. My background, by the way, is I used to sit on the Combined Authority. I was on the cabinet of the Combined Authority many moons ago. So I do come with a bit of a political understanding of the situation. So both of our local councils, Northumberland and North Tyneside, have cited the community promise as a good program, something that I wouldn't say that they're mirroring, but they're following a lot of it. They reference it, and by and large, we're following those 5 pillars between us. The Combined Authority also produced a paper a couple of years ago, which again looked at what we were doing, and again trying to get that system-wide approach to that social value and impact in our communities. So absolutely, the community promise is recognised by our local partners, and we do work with joint committees. We have held joint seminars. We attend health and wellbeing boards. We attend executive meetings with the local authorities, and this is absolutely drawn out in the conversations we have. North Tyneside Council Public Health Annual Report absolutely references us, and within that public health annual report also references the importance of employment and the link it has to good work, mental well-being, and those economic drivers in our community. So it's that wider system impact around our work as an anchor institution, and indeed our ICB. And I know there's been lots of the news about the future of ICBs, but it is absolutely written into their DNA to develop the community promise, and no shock horror, they've actually adopted the same 5 pillars that we have with pretty much the same wording. In terms of the future focus for us as an organisation and around that whole anchor approach, is the board is constantly challenging with, are we keeping our promise? Are we doing what it says on the tin? And I'll be presenting to public board next week about that. There's also a community promise development group, which is very much focused around that blue sky thinking and what next. If you work in the NHS, you'll know that we're committee rich and process rich, and the development group that we have is really an opportunity to kind of think around some of that. What next? What's the extra added value that we can do in the organisation. We're doing some refresh comms for our staff and to the wider community about more than healthcare. And we're also just recently had out to tender an income maximisation project. We have identified the provider. We'll be announcing it on the 1st of December, but that is based on the NHS Lothian model. So we'll be working with staff and patients to make sure that they are absolutely maxing out on what they are entitled to in terms of benefits. The NHS Lothian model, which you can Google, generated in its first year around £670,000 into the pockets of staff and patients who were not claiming what they were entitled to. So this is one of the big departures that we're going to be working on, which is about a staff and a patient support offer within the community promise. And as I say, we've just appointed the provider and we'll be announcing that on the 1st of December. And as I say, within the organisation, we're very much committed to looking at the 10-year plan, about our role in that, particularly around engagement and around inequalities. And as I say, working across the system, what I always say, what we do is probably what you're doing already. We badge it, it's got a name, it's bought in by the board, it's bought in by our executives. We have pillar leads as part of their day job, they're doing this, so it's business as usual. It genuinely is not rocket science. So everything I've told you today, you're probably doing it already, and in some cases probably also doing it better. But what I would say is, for us as an organisation sitting in this area, we absolutely see the work that we do as critical, but within the wider system, we are absolutely part and parcel of that whole anchor approach to improving outcomes for our local communities and as well for our staff. So I'm happy, if anyone has any questions, to take those, and I'll stop sharing my screen. So thank you very much for your time.
That's great. Thank you, Wayne, for that. It's a really great overview. And again, some great examples and case studies within there in terms of the initiatives that you've been able to share and develop over that period. Again, I'll just open it up to the group now, just in case there's any questions for Wayne. Again, feel free to raise hands or post in the chat function. I think just whilst people are thinking and digesting that, Wayne, one of the things that I think came through to me quite strongly as you presented there was the level of executive buy-in and support. So I think you talked about at the start, again, Jim Mackey's role in, again, promoting this. You talked across your 5 pillars in terms of each of those having a lead, and I kind of assume there'd be a lead at the executive level. And then you reflected at the end in terms of the board's role there and the board's challenge in terms of, are we keeping our promise? I suppose just a question for you in terms of how important do you feel that executive level support, visibility and buy-in, how do you feel that has been in terms of what you've been able to achieve in Northumberland?
100% mission critical. Unless you've got the buy-in from the board, it would have been a nice to have, but we're way too busy. Because this was done an evidence-based piece of work initially, which Jim asked me to do, which then resulted in a board paper, which then had buy-in from the board. And the result of the buy-in from the board was that had the trickle-down effect of it then had to have director level and then head of level support behind it. So it was absolutely critical to have that backing, and we continue to get that backing. And as I say, I'm doing a public board meeting next week, which is just a bit of an update on Q2 for what we've done. There is a constant stream of reporting into our system in the trust through different committees. We have our own kind of like blue sky thinking working group as well, but it is embedded, and I think I've used the phrase a couple of times, business as usual. That's pretty much what it is now.
That's great, thank you. Okay, any questions for Wayne? Yeah, Ollie, please.
Thanks, Wayne. Really great presentation. So you mentioned in your slides that you're being quoted by councils who are adopting, those pillars that you use. I was just wondering, have you started exploring any more kind of formal partnership working with other local councils around anchor initiatives, or even exploring the possibility of setting up a kind of local anchor network to take this work to the next level?
Yeah, I think it would be, it's common knowledge that this was one of the priorities of the ICB, and we've had some news about the ICB and what their future incarnation is going to be. That was very much part and parcel of their work, which was to develop that. We've done that kind of on an informal basis. I think the next iteration is going to be who leads on that, and the obvious part is the combined authority, which is where this has tended to sit in with other anchor institutions being developed, for example, in Manchester, in Yorkshire, a couple of other areas. But again, I think once the ICB have finally bedded down with what their responsibility is, I think the focus will absolutely come back onto this. But at the minute, there are lots of organisations who are doing a variation of what we're doing variation of what they're doing. So I think that there is a commitment and a will to do this, and I think that coordination bit is kind of informal at the minute, but yes, I think it would be good to have that led.
Thanks, Ollie. Thanks, Wayne.
There was a question as well saying, "Oh, people okay to contact me out of this?" Absolutely.
Brilliant. It's great. And maybe just one final question then, just looking at, so again, you picked up in terms of the deprivation levels that exist across the Northeast. And again, that is kind of informing the strategic assessment and approach. Do you have any mechanisms by which you kind of then report back against that? Can you kind of demonstrate impact against those deprivation levels and show how the work that you've done has helped to influence those indicators, I suppose?
Yeah, so we have some key performance indicators that we work to within the Community Promise. Most of those actually relate, it's data we already have. And most of them are about how we tell the story to our communities, about the impact of what we do. But I report to the Health Inequalities Board. We have a Health Inequalities Board within the Trust. We've done some work recently on DNAs, did not attend, around colposcopy, and we also did some work on maternity service. What that demonstrated was that some people were not turning up because either the bus service was really poor. We've done some work with the Combined Authority, who are the working on a bus and public transport strategy at the minute, so we've helped inform that. But we've also done something as well about allowing people to get their funding to attend appointments upfront rather than applying through the BSA. And that has made an impact on some of that work. Some of the other work around do not attends was around just simply getting phone calls to people, dealing with some of their concerns. That, not happy with a healthcare setting, feel a bit uncomfortable, didn't know what was going to happen. So there's some work around that. We've also, as I spoke earlier on about the involvement we have with statutory committees within the local authorities, we do report on things like the work that we've been doing around income maximisation. We've done a little bit of testing work on that already. We'll certainly be able to report on that going forward, because we'll have really robust data about a touch point, what that person has been able to achieve in terms of increased income, and what that means in terms of pounds and pence to their lives and to the wider community. But there's lots of different reporting mechanisms that we have around all of the pillars. We've been able to demonstrate an impact to what we do, and particularly as you've seen around education and employment, some of those figures are really, really, really positive.
Yeah, no, that's great, Wayne. Thanks. And I think the education and employment has definitely resonated with people in the chat in terms of those particular examples. And I think, again, there's quite a lot of parallels, to be honest, in terms of the population of Northumberland and again, Wales as well, because we have some pockets of really high deprivation in Wales as well. So I just like to say thank you so much for joining us today and for taking the time to share your work and your story with all of us as well, as part of the Health Anchors Learning Network. That's been fantastic. So thank you so much. Okay, thank you everyone for joining today. We appreciate your time. Just before we go, just wanted to hand over quickly to Ollie, who's going to give us just a quick reminder of where all our Health Anchors Learning Network resources are shared and stored.
Thanks, Chris. And yes, just to reintroduce myself to those people that weren't on the first webinar. So I'm Ollie, and I'm part of the team that runs the Health Anchors Learning Network. And just another reminder of the program that this webinar sits as part of. So we were commissioned by the Health Foundation to run a series of learning events and activities dedicated for Wales, recognising that there's a unique policy context in Wales, particularly around things like the foundation economy, and just unique, NHS, infrastructure in Wales. So we really wanted to create some Welsh-specific learning resources and some specific learning events. So that's what this webinar today was part of. And we've been gathering all of these resources on a dedicated learning platform. And I think Lauren's going to drop a link to that in the chat now, but I'll just quickly show the platform that we've created. So you can see it sits on the Learning NHS Wales platform, and it contains a range of resources. So there's some learning resources in there which can help you think, for example, about how to get started as a health anchor. You'll recognize this diagram from Vicky's presentation, and some links to additional resources to help you start on your journey. We also have a range of case studies that we are continuing to build, featuring examples both within Wales but also from across the UK. So anyone that's interested in learning more about this work and steps that you can take within your own organizations, I would recommend going in and signing up to the learning site. And there's also an option there to sign up to the newsletter to stay up to date with any future opportunities. So that's all from me. But yes, thanks everyone for coming along today. And Chris, back to you.
Great, thanks, Ollie. Appreciate that. So again, great to have that resource. And again, it's developing. We're adding case studies. So please do make use of that. Log in, have a look around. If you've got anything that you want to share, please contact, again, either myself, Lauren, or Ollie to add to that. It's great to have that resource available as we develop our network and community of practice across Wales. Okay, so I'll leave it there. Thank you very much again to Wayne and Vicky, who've joined us to share their case studies today. Thanks to Ollie for that overview of our resources, and thanks to all of you as well for joining. Really hope you enjoyed that session. And again, please do share it with your colleagues who might not have been able to make it today, because it is on record. So again, people can watch back. So thank you very much. Enjoy the rest of your day. Have a good Tuesday afternoon. Take care.